Thinking about starting metformin for your diabetes? While it's a powerful tool for managing blood sugar, it's crucial to know about its potential side effects before you begin. In today's video, we'll break down what you can expect when taking metformin, from common issues to rare but serious risks. Stay with us to make sure you're fully informed and ready to take charge of your diabetes treatment. If you found this video helpful, please subscribe and click the notification bell for more informative videos like this. Thank you. Before we dive into some of the less common side effects of metformin, let's first cover what it is and how it works. Metformin is a medication used to lower blood glucose levels. It's often one of the first treatments prescribed for type 2 diabetes, and sometimes even for prediabetes. You'll see it used frequently. However, there are cases where metformin might not be suitable, which we'll touch on later when we discuss some of its rare side effects. So, how does metformin help in lowering blood glucose levels? Metformin helps lower blood glucose levels through several mechanisms. It inhibits gluconeogenesis in the liver, which means it reduces the production of new glucose. It also decreases glucose absorption from the gastrointestinal tract, causing more glucose to be excreted in the stool. Additionally, metformin increases insulin sensitivity by enhancing the activity of insulin receptors, allowing cells to absorb glucose better. One of the most common side effects of metformin is diarrhea. This usually happens more with higher doses and often disappears after a few weeks as your body adjusts. Sometimes, if the dose is increased, the diarrhea might come back, but it usually resolves with time. It is related to changes in your gut bacteria, which adapt over time. Common side effects of metformin include gastrointestinal issues such as flatulence, stomach pain, and an upset stomach. Flatulence, or excessive gas, can occur because metformin affects the digestion and absorption of carbohydrates, leading to increased gas production in the intestines. Stomach pain and discomfort may arise as the medication interacts with the digestive system, causing irritation or altering the normal digestive process. An upset stomach can also result from these changes, leading to symptoms like nausea or a general feeling of unease in the abdominal area. These side effects are typically dose-dependent, meaning they may become more pronounced with higher doses of the medication, and they often improve as the body adjusts to the drug over time. If these symptoms persist or become severe, it's important to consult a healthcare provider for advice and possible adjustments to the treatment. In rare cases, metformin can cause hypoglycemia or low blood sugar. This is more likely with high doses, especially if you're fasting or exercising. It happens because metformin affects glucose absorption and insulin sensitivity. Besides hypoglycemia, metformin can also cause headaches and excessive sweating. The sweating may be linked to low blood sugar levels. Now, let's talk about some of the weird or typical side effects of metformin and use some of these, including heartburn and dyspepsia, so there can be increased acid reflux and epigastric pain is above the belly button, sort of in the upper abdomen chest. Discomfort can occur along with this. This happens because metformin may act as a weak histamine agonist, and histamine is part of a particular pathway in the stomach that causes the release of gastric acid. Hence, this is why we can see heartburn in some cases of metformin use. Metformin can cause a change in taste. The patient is going to describe a metallic taste in their mouth. This metallic taste can be a lingering effect, so even if they've had a dose and haven't taken a dose for many hours, they can still have this lingering effect in their mouth. And the reason that this occurs is that metformin is excreted in the saliva. It is detectable. It can be in detectable amounts in the saliva, so we have this sort of weird taste, often described as a metallic taste in the mouth. This excretion in the saliva can continue to occur at a slow level or a slow rate, even many hours after the last dose of metformin. We can also see in some cases acid and/or sour taste if they have heartburn. Metformin can increase the risk of respiratory infections, and there does seem to be an increased probability of respiratory tract infections in some patients on metformin often. These can be upper respiratory tract infections, so common cold. Bacterial pneumonia also seems to be something that occurs more frequently in patients on metformin. And then COPD hospitalization is also more common in patients with metformin. These are some preliminary data, so we'll have to wait to see if there is any more data to support some of this. But in some patients who are very, very sick, metformin may increase the risk of more severe respiratory tract infections, along with increased requirements of ventilation again in very ill patients who have lung disease. Metformin can sometimes cause rhinitis, which occurs in some patients with metformin. This is an inflammation of the nose. Patients can have rhinorrhea, runny nose, and nasal congestion. They may feel like they need to sneeze. This can also occur in some patients as well, although it is going to be more uncommon. Metformin may increase the risk of skin infections, like cellulitis and foot infections. especially in people with severe diabetes. People with diabetes must check their feet regularly to catch any potential infections early. Metformin can sometimes cause muscle aches or pains, known as myalgia. This might happen because metformin can lead to muscle wasting through changes in specific proteins that affect muscle growth. Some patients on metformin might experience muscle weakness and fatigue, known as asthenia. This could be related to the muscle wasting caused by the medication. A lesser-known side effect of long-term metformin use is vitamin B12 deficiency. As patients use metformin over time, they are at increased risk of developing this deficiency because the medication affects the absorption of vitamin B12 in the intestines. This deficiency may also be linked to calcium deficiency, and treating calcium deficiency can sometimes improve vitamin B12 levels. Vitamin B12 deficiency can lead to several symptoms, such as macrocytic anemia, where red blood cells become more significant than usual, causing fatigue and shortness of breath. Patients might also experience general tiredness and a low mood, which can sometimes be mistaken for depression or dementia. Vitamin B12 deficiency can also trigger neurological issues like numbness or tingling in the hands and feet. Observing vitamin B12 levels in patients on metformin is essential, especially if they show signs of fatigue, mood changes, or cognitive problems, as supplementing vitamin B12 can help address these issues. A severe but rare side effect of metformin is lactic acidosis, which is a condition where the blood becomes too acidic. This is a significant concern highlighted as a black box warning for metformin. While rare, the risk is higher in specific patient groups, including those with liver disease, kidney disease, congestive heart failure, or those taking specific medications like carbonic anhydrase inhibitors or topiramate. The risk also increases for people over 65 and those who consume heavy amounts of alcohol. For persons with liver or kidney disease and congestive heart failure, metformin is usually avoided to prevent this risk. In other cases, such as with older adults or heavy alcohol use, caution is advised. Lactic acidosis can cause symptoms like nausea, vomiting, and rapid breathing as the body tries to correct the increased acidity in the blood. It's essential to be aware of these risks and monitor for symptoms, especially in patients with these specific health conditions. Maintaining awareness and being proactive about your treatment is crucial for effectively managing your diabetes. By staying informed about your condition and regularly monitoring your health, you can make timely adjustments to your treatment plan, address any issues, and ultimately improve your overall diabetes management. Being proactive means taking initiative, such as regularly checking your blood sugar levels, staying on top of medications, and making necessary lifestyle changes. If you found this video helpful and want to stay updated with the latest information and tips on managing diabetes and living a healthy life, don't forget to like this video, subscribe to our channel, and click the notification bell. This way, you'll be notified whenever we post new content. Thank you for watching, and see you in the next video.